na-diagnose po ako ng cancer noong November 2023. Ang simula talaga ng aking nararamdaman noon ay sa ipin lang. And then, ayun, nakita na may cyst na, may bukol na ako sa gum. Tapos, required naman ako for MRI. Lumabas sa aking result na mayroon nga daw akong osteosarcoma. And then, na-confirm nung myopathy ako na ito ay adenoid cystic carcinoma. Which is, rare daw yun, sabi nila. May possibility siya na umakyat sa pataas at kumalat pa sa pababa ang liig. Nag-undergo ako ng operation, which is tinanggal yung kalahati ng nalagal ako. Kaya ganito ako magsalita.
Paano po ninyo na-meet or nakilala si Dr. Jansen and yung Simply Nature PPARS?
Kilala ko po si Dr. Jansen at na-meet ko po yung Simply PPARS. Dahil po nanonood ako sa Facebook, nung nag-tip na ako ng Simply PPARS, talagang malakas po katawan ko. Simulat sa po, hindi ako sinipon, hindi ako nilagnat. As in, malakas ako. Talagang maraming na-amaze sa akin. Pumayat ako sa treatment ko, pero nakikita nila na malakas ako. Kaya pati yung mga team na radiology, ang sabi sa akin na maganda daw yung malat ko, hindi daw nasunog. Dahil yun sa simplificar. Kasi yun ang katuwang ko. Ako'y nagpapa-radiation. Sa umaga, radiation ako. And then sa gabi, nagtitik ako ng PPAR. Dati, ang required sa akin ay chemo at radiation. Pero nung nakita na on ko na nag-stay lang yung at walang kumalat kahit sa ang hinakatawan ko, radiation na lang, na-required sa akin. Ayun, papasalamat talaga ako. At nakilala ko yung simplificar at Dr. Jansen. Malaking tulong talaga. Parang hindi ako nagpapagod. Kilos ako ng kilos, ako nalilinis, ako naluluto, at namamalinti pa ako mag-isa. Pero kilos pa rin ako ng kilos, parang bigla akong maisip na, ano pala, may uuupin ako na, may ganito ako, gano'n. Dati kasi may osteoarthritis na alam ako. Pero mula nung nag-testin ako, nawala lahat yung nararamdaman ko. Malakas ako at maganda yung tulog ko. Talagang pahagising mo sa umaga, wala ka nararamdaman na, masakit yung ganito ko, ganyan, di ba yung kapag nagkakaedad na tayo, masakit yung tuhod, masakit. Ako asin wala parang fresh, parang bumata ang pakiramdam ko. At marami nagsabi, mas naging blooming lang ako ngayon. Ayun yan sa pagsisin ko na simplificar. Ako po, si Ma'am, na-diagnose ako na adenoid cystic carcinoma. After ko maoperahan, nag-take ako ng Simply Nature-Inc at noon po ako lumakas. Napabilis ang aking paggaling. Kilos ako ng kilos. Nakakalimutan ko na may sakit pala ako o naoperahan ako. Kaya sa Simply Nature, lumakas ang katawan ko at napabilis yung paggaling ko. And I trust Simply Nature.
Hi everyone, these are the important questions. Do I need to go for chemotherapy? How many sessions of chemotherapy do I need? What about immunotherapy? What about surgery? What about CT scans? Well, join us on our Simply Healed program every Thursday nights at 7:30 p.m. Singapore, Hong Kong and Philippine time. Our sessions are interactive, featuring a live Q&A with experts and doctors who will answer your questions in real time. You can type in your questions and get immediate, personalized responses. This is your chance to take control of your health. So take advantage of this informative and supportive experience. Visit our Facebook page and message us on Messenger to find out more. See you there this Thursday.
Boost your health today with Simply Nature Power Pack, a 5-day combo pack of Simply Nature PPARS for immune boosting and Simply Nature Cleansing Plus for effective detoxification. Experience this dynamic duo now. Available on Shopee, Lazada, and our website www.simplynature.asia and our office here in BGC. Grab yours today!
One reason why I recommended initially PPARS is because it can induce lung cancer cell death. The main reason why I tried PPARS liquid, and it did well for the patient. It helped with the tumors. The enlarged abdominopelvic lymph nodes were not detected. This was gone. So that was something that I was actually quite surprised. A 12-centimeter tumor disappearing.
Everybody turn to your neighbor and say, do more. Right? Don't just think there is no one product that will cure you of cancer. Okay, that is like it's like a scammer trying to sell you something. All right, it is a comprehensive approach. When you need surgery, do the surgery. But prepare for the surgery so that you recover well, right? And then if you need to do chemotherapy, radiation therapy, do it. So this is where PPARS really comes in. It's a gene activator, so it's a signaling pathway. It switches on your pathways, your systems. Then the other nourishment that you take will be properly used. Is it easy to understand now?
Now let's not keep you waiting. We are now officially opening the AMA or Ask Me Anything portion.
So she has to take maybe just the capsule or the powder just to regulate blood sugar. And then undergo the surgery, and after the surgery, to aid in wound healing also and for recovery, she can continue the capsule.
I can safely say this, all LJ products are great. But if you have acute illnesses like cancer, then we are a world of a difference. Because if you want chlorella, take chlorella. Diba? If you want spirulina, take spirulina. When you take Simply Nature PPARS, you're taking our microalgae for its PPAR agonist.
We are always with you from start to healing.
Simply Nature webinar. This program is brought to you by Simply Nature International and Simply Healed Medical Group. Just to recap on our last week's topic, last episode we discussed managing diabetes and hypertension, avoiding the path towards cancer. Lots of questions were asked and most importantly, answered by our experts. And this week, discover how cancer patients or metabolic illness patients can benefit from using PPARS because tonight's interesting topic is entitled Colon Cancer, Elevate Your Survival Chances. Colon cancer is one of the most common types of cancer, but thanks to the advances of early detection, treatment, and post-care support, more people than ever are not only surviving but thriving after their diagnosis. This webinar is dedicated to providing valuable insights, sharing inspiring surviving stories, and offer practical advice to help navigate the journey of surviving colon cancer. Our goal today is to empower you with knowledge and support to help you or your loved ones navigate this journey with confidence and hope. We extend our sincere gratitude to each and every one of you for tuning in to this webinar. And of course, we encourage everyone to share this online event to your friends and loved ones who can benefit from the insights shared here tonight. So without further ado, let's dive right in. Please note that there will be what we call AMA or Ask Me Anything portion later on after the discussion. So please feel free to drop your questions. And yes, kahit po Tagalog, pwede. So, leading our discussions tonight are distinguished health experts. First off, I'd like to introduce a successful entrepreneur who is also a seasoned international speaker on a wide range of topics, from personal success to healthcare. He is the CEO and founding director of Simply Nature International, Mr. Shyan Lim. Another health expert tonight it is an honor to present an esteemed speaker, Dr. Jansen and He is a distinguished graduate of St. Luke's College of Medicine, and he is a diplomat of the International Board of Lifestyle Medicine and Philippine College of Lifestyle Medicine, currently serving as a consultant at renowned institutions including Alta Integrative Medicine and Wellness Complex, Tree of Life Wellness Center, Centro Holistico, and Simply Healed Medical Group. Dr. Kalalan specializes in the treatment of cancer and metabolic illnesses. Please join me in welcoming our experts. Here first, let's all watch this.
The problem is the food that the patient eats. The problem is the sedentary lifestyle of the patient. So if you just put the patient on medication, then you will only control for the symptoms. But you won't be able to solve the root cause of the disease, why the patient has the disease in the first place.
Hi everyone, welcome to a very special episode of Simply Healed, because today we are observing World Diabetes Day, and a special thank you to the International Diabetes Federation for highlighting our special episode. And of course, welcome Doc Jansen.
Hello Shan, hello everyone, happy to be here.
Doc Jansen, diabetes is actually your bread and butter, right?
Yes.
As a lifestyle medicine doctor, you specialize in metabolic syndromes. I mean, that's the most easy thing and direct thing to treat with lifestyle medicine. And today, on World Diabetes Day, can you tell us a simple question? Number one, can diabetes be reversed?
Yes, absolutely yes.
Okay, doc, but there are some doctors and even specialists, diabeticians, right? Who say that diabetes cannot be reversed. Can you clear that up a little?
Well, it's because diabetes is a lifestyle disease. Now, if it's a lifestyle disease, then the solution to that problem is also lifestyle change. Okay? So there's no way for you to reverse diabetes just by putting a patient on medication alone.
Because you're always creating the problem every day.
Yes. The problem is your lifestyle. The problem is the food that the patient eats. The problem is the sedentary lifestyle of the patient. So if you just put the patient on medication, then you will only control for the symptoms. But you won't be able to solve the root cause of the disease, why the patient has the disease in the first place.
Doc, I think while we are saying this, and to all the diabetic patients that are watching us right now, I think it will be very helpful to thoroughly or more clearly understand what it means to be diabetic. You know, Doc, for most diabetics, being diabetes means I have a high blood sugar level. Is that really what it means to be diabetic?
Now, high blood sugar level is just a symptom of diabetes. Now, that is what doctors measure to know how severe your diabetes is. But if we define diabetes or what colorectal cancer is a disease of those who are already in their latter
It
years.
should
in
be
their life.
for it's an old people's
cancer.
cancer. Yeah.
Yes. Okay. Usually, people with colorectal cancer are already past their middle age, and now we are beginning to see patients who are in their middle age and even younger.
The statistics are very interesting. The next one says that the incidence rate dropped by 2% each year in adults older than 50 years. So there's literally a shift from an old person's disease is starting to become a middle-aged person's disease.
Yes. You know why?
Hi, welcome to Simply Healed again, and today me and Dr. Jansen are back here together. Hi, Doc.
Hello, Shyan. Hello, everyone. Happy to be here again with you.
Today we're going to talk about one of the most common cancers that are occurring today, which is colon cancer. And we're just going to give a little bit more in-depth discussion about what colon cancer is, what it looks like for those of you who don't have colon cancer, and how can you elevate your chance of survival. So tonight is a pretty on-the-spot topic focusing on colon cancer, but don't worry. At the end of our very short discussion, which is about 15 to 20 minutes, we will be opening the floor to ask me anything. And you can ask anything, right? Even if you want to ask what's Dr. Jansen's favorite Korean dish, right? Yeah, you can. But more importantly, you can ask about any other illnesses that you have, other types of cancer, and questions related to that. So, Doc, colon cancer, take it away. Tell us about colon cancer.
Now, first, let me show you what a colonoscopy looks like. Okay?
It looks pretty good. I mean, it looks clean. This is what a healthy colon looks like.
This is what your colon looks like when
not
the
disgusting at
shows
all,
that.
you know. I usually don't like to look inside the human body, but this looks good.
Yeah, so there should be, it should look like this. This is what normal looks like. Now, the next slide is what colon cancer looks like. Now, this one is a fungating mass, actually with a lot of mucus. To some degree, it also has some pus already. Okay, so this is quite a big tumor inside the colon. Okay, so this is what colorectal cancer looks like. Okay, now for a little bit of statistics, colon cancer is quite common. It's the third most diagnosed cancer globally. From 2014 through 2018, the incidence actually rose by 1.5% each year for adults younger than 50.
So that means people are getting younger and younger, getting cancer.
People who are getting diagnosed with colorectal cancer are getting younger and younger. And mind you, colorectal cancer is a disease of those who are already in their latter years.
It should be
life.
for it's an old people's cancer.
Yes. Okay. Usually, people with colorectal cancer are already past their middle age, and now we are beginning to see patients who are in their middle age and even younger.
The statistics are very interesting. The next one says that the incidence rate dropped by 2% each year in adults older than 50 years. So there's literally a shift from an old person's disease is starting to become a middle-aged person's disease.
Yes. You know why? As you get older,
yes,
you change your lifestyle. You change the food that you eat.
That's true. Number one, your appetite isn't that good, and you are more aware that you might. I mean, you're going back to heaven soon, so you take care of yourself.
Yes, people just tend to take care of themselves more, better, or they eat food which are a lot healthier. So people tend to become more health conscious when they get older. All right, so yeah, so that's
something on a more serious note. It's actually the second leading cause of death in cancer. So colorectal cancer is one of the major causes for cancer deaths.
Now, let's go to the signs and symptoms of colorectal cancer. Now, the signs and symptoms, as you have read here, are quite non-specific.
Yeah,
okay?
It's pretty much, it could be anything.
It could be anything.
So don't give yourself a cancer scare,
yes,
all right?
Okay? Yeah. Now, how do you know that what you are feeling already is might already be cancer.
That's
So
important.
it should be a myriad of these signs and symptoms.
It means
Okay?
a combination, not just one.
Okay, so let's say for example you are quite constipated, and then when you poop there's blood. The amount of stool that you are
Poop that's coming
excreting
out.
is pencil-like, so it's like a pencil.
Oh, very thin.
Very
it's
thin.
because remember the picture you saw in front. There's an obstruction
Box.
in your colon, so
Yes.
it's like
It's like pushed
push.
through. So that's one of the reasons. And then of course you'll have unexplained weight loss, and then you have a family history of colorectal cancer or any other cancer for that matter. Then you begin to consider, what I'm feeling right now might be cancer. So that should prompt a consultation already, especially if you have blood in your stool.
That's always a no-no.
Okay.
Whether or not it's cancer or not, it's time to go and see a doctor so
Yes.
that whatever is troubling you will be addressed. It's not good to have blood in your stool.
Okay. Now, of course, these signs and symptoms, like what I have just mentioned, like the family history, should be interpreted according to risk factors as well, because these signs and symptoms can mean anything. Okay. So let's go to the risk factors. So what are the risk factors for developing colorectal cancer? So these are the risk factors. But let me show you the more notable ones, like chronic inflammatory bowel disease, and especially a low fiber and a high fat diet.
Yeah, Doc, we look at the list. It's quite obvious that nobody needs to be told that if you live a sedentary life, that means you just sit and watch Netflix all day. You're not going to be healthy. And those who smoke and drink alcohol, you know yourself, right? So what I do think, like what Doc you highlighted, is those of us who try to be healthy, we may need some advice on like where to focus our efforts. And it seems here for colorectal cancer, focus your effort on more fiber intake.
Yes.
All right.
Okay.
So if you take more fiber, that will definitely help.
All right. So here are the things that you should do in order for you to be able to reduce your risk of developing colorectal cancer. Of the fiber. Now, fiber. Why is fiber so important?
Yeah, that's
why
a-
it's always.
And it's not just cancer,
emphasized.
it's got to do with mental health.
Yes.
Everything.
Everything. It has something to do with your gut microbiome.
Mm.
People or humans cannot digest fiber.
Yes.
Okay?
Mm.
We cannot break down fiber. Only the gut bacteria inside your colon can break down fiber. And when the gut bacteria digests the fiber that you have just ate, it produces short-chain fatty acids like butyrate, which have the anti-cancer properties, which also increases serotonin. It has a big influence on the neurotransmitters that is secreted by your brain.
No.
Makes you feel better overall.
Well, you said a magic word, right? You said an anti-cancer. What is that? Anti-cancer nutrient. And here we are looking to see the latest supplement, looking for the latest anti-cancer substance when our own body makes anti-cancer substance. And you know, right, whatever your body makes is probably designed for you, right? Because it's something of, and all you needed to create this anti-cancer nutrient in your body is fiber. So I hope that helps. So let it be an encouragement to all of us to go more plant-based, and if you eat plants and fruits, take the high fibrous ones, because your body is actually going to use it and produce anti-cancer substances.
Okay, so that's for the diet. Now let's go for the screening.
Okay,
How
yeah.
do we diagnose?
Because age, right?
Yes,
You talk about age.
age.
At what age do we know to go for screening?
Okay.
So, why is screening important first?
Alright, screening is very important because
Yes.
colon cancer is curable if detected early.
There you go,
Okay.
everyone. Cancer is very treatable if you detect it early.
Okay, let me show you the
How
data.
treatable?
Okay, this is the prognosis. Colon cancer is curable if found early. That's why screening is very important. Now, let me show you the overall survival rate of colorectal cancer. So, combining all stages, all types of colorectal cancer, that is 65%. Okay, so this means that 65 out of 100 colorectal cancer patients live after 5 years. Okay? Now, of course, this is combining everyone, right? Now, let's focus on the early stage. The localized stage is 91%. So, 91 out of 100 people who get diagnosed colorectal cancer very early on and get treated survive after 5 years.
So it's a sure bet.
It's a sure bet.
It's a sure bet.
They live, right?
So screening becomes a very important strategy, guys.
If you get diagnosed with colorectal cancer stage 4 on the outright, okay, then your chances of survival significantly goes down to 15%. Okay, so at what age should you be screened for colorectal cancer? So at 50 years of age. Okay, so this is for individuals who have no family history of colorectal cancer at all. So like me, in my family, we do not have any relatives, family members who develop colorectal cancer. So me, I have to undergo colonoscopy at 50 years of age.
Okay, that'll be for me in 2 years' time.
If you have a family history of colorectal cancer, so let's say for example, your dad, your grandfather died of colorectal cancer, then you should get colonoscopy 10 years earlier than the age when the immediate family member got diagnosed with cancer. So let's say for example, your grandfather got diagnosed with colorectal cancer at 55 years old. So you should get colonoscopy at 45 years old. So that's how we go about it. Now, once you get diagnosed with colorectal cancer, what are the other laboratory tests that we should get? Number one is CEA. So that CEA, or carcinoembryonic antigen, is the biomarker for colorectal cancer. Now, CEA is quite non-specific as well, but more often than not, it tends to get it becomes increased with colorectal cancer. Okay, so this is what oncos use. Now, CEA, just using CEA alone should not be used as a screening tool. Okay.
Okay. That's good advice. No, CA not a screening tool.
Okay? It's not a screening tool because there are a lot of factors that can increase it. All right? Now, CEA should be used in the context of the diagnosis of colorectal cancer and use it as a treatment response marker.
That means every time you go for your chemotherapy and everything, you want to know how well it's working. You look at the CEA.
Is it going down? All right? So once, okay, so let's say for example, you are someone with colorectal cancer, you are a candidate for surgery. Now, before you undergo surgery, you should get your CEA tested, okay? Then once you have finished surgery, your CEA should again be tested
to see if the surgery has improved.
Yes, to see if the surgery really removed all of the tumor, okay? Now, that is the use of cancer biomarkers, okay? Like CEA. Next is imaging. So we have to stage your cancer. So depending on the stage, the appropriate treatments would be recommended. But more often than not, if you have stage 1 colorectal cancer, best to have it removed, number 1. And number 2, you have to still go for chemotherapy to be sure. Okay? So what are the treatment modalities that you would expect if you have a colorectal cancer? So mainstay is still surgery. Okay, so if you are someone who is trying to seek an onco, let me refer you to my good doctor friend, Dr. Jimmy Katapia. So Dr. Jimmy Katapia is a surgical oncologist who manages a lot of colorectal cancer patients. My goodness, and he's actually quite good.
He's very good actually.
Yeah,
and I think it's very important here. I mean, if you are here in our locality, we can refer you to our doctors. But maybe, one day, Doc, we have to do an episode on how to choose the right doctor as well. I think this is it, Find a doctor that would take the time to explain to you what conditions you are in. And, I really, really think as patients, we have the right to ask questions. Why? Because whatever the doctor does, whether it's successful or not successful, we are the ones that feel the pain or feel the joy or feel the treatment, the healing or the sickness. So if you're the one experiencing all the outcomes, I think you have the right to ask the person what's happening to you and why is he doing this to you. So that's my advice, so that you can find doctors that will explain to you so that you can make your decisions not out of fear and not out of ignorance. You make a decision knowing how to do something on your own as well to whatever the doctor is doing to you. If you understand what he's doing, you can do other things to work in concert, right, to make his treatment even better, and then you will avoid doing things that will clash with his treatment. So that's how I would choose doctors. So Dr. Katapia, Dr. Jimmy is one of those oncological surgeons who understand nutrition, the importance of nutrition, the importance of strengthening the patient between chemotherapy and after surgery. So he will then work with doctors like Dr. Jansen. So that's what you want to find when you assemble your own doctor team when you are treating cancer. So Doc, how would you treat colon cancer?
Again, it's multifaceted. So I approach colorectal cancer in multiple ways. Okay, so number one is to remove the headquarters of the tumor. Okay, if you remove the headquarters, then the tumor burden significantly goes down because the headquarters is not there anymore. Okay, so what we need to, after removing the tumor, what we need to worry about are the microscopic tumors and the recurrence now. So it's one less thing to worry about. So surgery, again, is the mainstay. Number two, natural treatment. Very important. You have to have a high fiber diet. Okay, and not only that, you have
so the natural treatment we're talking about is not like something complicated like lingzi or some Chinese concoction, right?
No.
So the natural treatment is as simple as taking more
Eat
fiber.
more fruits, vegetables, whole grains, and legumes. Now, the question is, which of the fruits and vegetables should you be eating? Now, you have to go for a consult. Okay, so I can give you the list. All right? Now, next is chemotherapy. You have to remove all the microscopic cancer cells, okay, circulating around your body. So this chemotherapy, the purpose of it is to reduce the recurrence of the cancer. If the cancer does not come back, then it becomes clinically insignificant. It becomes insignificant to your body because it's so small, right? Why would you worry about something so small, right? So if it's not causing you any symptoms, then there's nothing to worry about, okay?
So again, for everyone, this is not an endorsement of chemotherapy without reservation. We are very well aware of the many side effects of chemotherapy and that patients can actually die from chemotherapy instead of cancer. So it's not that we're ignoring that, but why are we so confident to tell you to look into chemotherapy is because we have protocols, we have extracts that can protect you from the negative side effects of chemotherapy. Hence, you should really look at the benefits of chemotherapy because you don't have to worry so much about the side effects. Just have a consult with Dr. Jansen, you'll be able to manage all the side effects. Again, refer to our YouTube specifically on this topic, and that will open up the options.
Chemotherapy, yes, the benefit would, kill the cancer cells. But of course, how about the healthy cells?
It does hurt it.
Yeah, it will hurt your body, yes. But is there a way wherein we can mitigate that side effect? Protect the bone marrow, protect your immune system, protect the integrity of your body? Yes. Okay? Now, chemotherapy is given in cycles. Why is it given in cycles? It's order for your body to rest.
To recover.
Yeah, to recover. Now, the problem is some patients cannot recover fast enough to receive the next cycle. So
all patients are doing nothing
to
recover.
To recover
in between.
Yeah, in between. Okay, or to recover fast enough to receive the next cycle. My goal for our patients receiving chemotherapy, it's to allow your body to recover faster in order for you to receive the next cycle. Okay, and how do I do that? Food, Simply Nature PPARS. Okay?
And the end result is red blood cell counts and white blood cell counts remain high.
Remain high.
And that's a very important indicator to your onco.
Right? So next is radiation therapy. But radiation therapy is only reserved for rectal cancer. Okay? Because the bowel is continuously moving. Right? So if you are going to undergo radiation therapy, the target should not be moving. Okay? So radiation therapy is only reserved for rectal cancer because the rectum is fixed. Okay,
got it.
Next is immunotherapy. Like the dostarlimab. So
this is very exciting. I saw the news when it came out.
Yes,
I think it came out in this year.
This year, a few months ago. I think 2 months ago. Yeah, the news about a new drug or a new drug therapy for colorectal cancer.
A specific type of colorectal cancer?
Only for colorectal cancer. Actually, dostarlimab is being used for other types of cancer already. Now, colorectal cancer is a new one. Okay, so they tried using dostarlimab for colorectal cancer, and lo and behold, all patients was cured of colorectal
Early
cancer.
stages?
No, these are advanced. These are recurrence. So there you go. These are some of the treatment modalities that you can opt for if you develop colorectal cancer. But please mind you, if it is indicated, please go for it. Okay, if your onco advises you to go for it, please do so. And don't forget to, don't forget the natural treatment. Of course, we have to address the root cause. Still the root cause. Okay, so in the approach for cancer treatment, okay, it's not just important to remove the tumors, or it's not just important to remove the old branches or the rotten branches. It's also very important to nurture the tree so that there won't be any more rotten branches. So nurture your body. So that's why natural treatment is also very important here. Okay?
So even though we have dostalimet, you still will need to do some adjustments in terms of supplementation, lifestyle adjustments, dietary awareness on what to eat and what not to eat, so that you can live, you can choose better, live a quality life, and be 100% treated. Our PPARS extract, and not the PPAR agonist, all right? It's actually in the extract itself. So it's not the PPAR agonist, the extract itself. There are components in the combination of phytonutrients and agonists that we are able to promote or increase dendritic cell activity. Dendritic cell activity is the one that actually detects cancer. So one reason why Dr. Jansen's patients who use our protocol is able to see good results with cancer is because your own immune system is actually properly aiming and hitting the right target, right? Because it can detect cancer. So I thought it would seem that with dostalimet and increased dendritic cell activity,
that will work.
Yeah, because not only do you remove the cloaking device, you also make sure your targeting mechanism, your immune system is shooting straight, right?
Yes.
Then
yeah,
again,
it works well together.
It works
so
well.
sometimes I experience that, especially when I combine PPAR agonists with chemotherapy, I advise patients to also take PPAR agonists, especially when they're undergoing chemotherapy. My purpose was to mitigate the side effects, but somehow the oncos, hey, your tumors are responding well. There are a lot of shrinkages.
So the treatment works even better because
it works even better. Now we can stop your chemo. Don't have to finish all 8. We can just stop at 6.
So
sometimes we get through.
So again, we say this so often in our program. Don't just go for one approach to cancer. Cancer has to be approached in many angles. If your onco doesn't say that, then let me tell you, even your onco uses many angles. You know why? You know why? The chemotherapy drugs that you use, they are seldom, not never, but they're seldom used in isolation. It's often always a cocktail of chemotherapy drugs. So even an onco actually attacks cancer from
different angles.
Yes. We actually have a program on how chemotherapy drugs work on different angles. So search on it on YouTube. And we hope that, I'm going to steal Dr. Jansen's line right now. I hope that you learned a lot today. Alright? That your increased understanding will help you make the right choices in combining different approaches to treating cancer. So don't do it blindly, do it with understanding. And if you have questions, you don't understand clearly, just ask us as we move to our Ask Me Anything. Any last words before we start answering questions?
Nothing anymore for me. I see already a lot of questions coming up on the
Yeah,
screen.
and I stole his line, so I hope you learned a lot today.
Let's get to it.
Let's get to it.
To another episode of Simply Nature webinar. We are now in the what we call AMA or Ask Me Anything or Ask Me Anything. Also, of course, Miss Jeanette Koo and Miss Helen Kamonayan. Thank you so much for watching. We really appreciate your presence for tonight's episode. So, let's not keep you waiting. Now to answer our questions in this modern world filled with noise, different health opinions, trust the ones from the experts. Let's call once again Mr. Shyan Lim and Dr. Jansen to answer our questions for tonight. Good evening, Sir Shyan. Good evening, Dr. Jansen.
Good evening, Sheila. Good evening, Dr. Jansen.
Hello, good evening to both of you. Hi to all our audience, no, who are watching tonight.
Yeah. All right, Sheila, let's jump into the Q&A.
Okay, let's go. All right. So for our first question for tonight, coming from our inquirer from YouTube, from our YouTube channel, his question is, can PPARS cure stage 4 cancer of hypopharyngeal cancer?
Maybe let me take that. I think cure is a very strong word because cancer is very difficult to make that statement. Can it help? Yes. Has patients with similar conditions actually recovered and are in remission? The answer is yes. So in terms of possibility, yes, but there are many, many factors that go into it. And regarding which is the best strategy for you, then I would actually, since it's a 4th stage, is it, Sheila?
It is.
Nasopharyngeal?
No, it's actually it's this hypopharyngeal.
Oh, all right. So since it's 4th stage, I would very, very much encourage you to go for a consult with Dr. Jansen so that more details can be comprehensive strategy. Again, cancer is not something that you cure with one magic bullet or only one approach. But I can share with you that Simply Nature is going to be a very protocols are going to be an important part in your successful fight against your cancer. So, Dr. Jansen.
Yeah, that's true. It's very actually, don't say that we can cure cancer. Okay. This is not something that doctors are afraid to claim because of disclaimers, or we do not want to overpromise. It's just that it is the reality. We do not have any technology that can cure cancer right now in existence. There's none. Yeah. So if someone is promising you that hey, I can cure the cancer, etc., etc., don't believe the guy. Okay. more often than not, yeah, the guy is selling you something to make money out of you. So again, there's no product or technology in existence right now that can truly say that they can cure cancer. What we say is that we can help the cancer, help the patient go into remission. So what does remission mean? It means that on imaging and on tumor markers, there's no evidence of cancer. Okay? So that's what remission means. So for example, early stage breast cancer. Early stage breast cancer, the patient had a mastectomy. Upon imaging, upon repeat imaging, there's no cancer left. So in that sense, the patient is on remission. We cannot say that the patient is cured of cancer. Okay. So let me also explain why we cannot say that we can cure the cancer. It's because each and every one of us, even those who don't have clinical cancer, okay, or clinical signs and symptoms of cancer, all of us have cancer cells circulating around their body. It's just that it doesn't manifest because our immune system is fighting the cancers off, killing the cancers off. So when you say cure, okay, we're playing with terminologies here already, no? When we say we're cured of something, there's this disease, we give the treatment, the disease goes away. Okay, so that's what cure means. So say for example, you were bitten by a snake, you were poisoned. We give you the antidote. So immediately you go back to normal. Okay, that is cure. Okay, in cancer, there's no such thing because of how cancer is, because of how the disease is. Okay, so again, cancer is a genetic disease. It's a mutation in your DNA. So, and of course, each and every one of us have cancer cells circulating around their body. So there are always cancer cells, circulating. It's just that it's just a question of whether it will manifest or not. Okay. So in that sense, we cannot really cure someone of cancer because of this, because of this concept, because of how the disease is. Okay, I hope you understood the question you asked, and I hope you also understood the definitions, no, with these terminologies.
Yes.
So a very difficult position because it's fourth stage cancer. So I want to start with good news that we have patients who have done well. Sheila's own son was fourth stage nasopharyngeal, right? And he's survived. He's passed his 5-year mark. So congratulations, Sheila, to Dominic. Yeah. So my advice: quickly go for immediate consult with Dr. Jansen.
Yeah, I just want to quickly share something that I've learned from our two experts, from Sir Shyan Lim and of course Dr. Jansen. This is the very reason why everybody should still be vigilant even after the remission phase, because cure is not really the word for cancer, even if it's gone already. Okay. All right. Well, thank you so much, Dr. Jansen, and of course, Sir Shyan. Next question, thrown to us privately by our viewer. Can you explain the role of surgery, chemotherapy, and radiation in treating colon cancer?
Wow, Doc, I think you're the best one. But Doc, simple, huh? Or else you'll end up
Okay.
with
Okay, okay, I'll make this as simple as possible, no? And also easy for you to understand. So, before I answer this, so let me first explain, no, how colon cancer progresses, no? How does it start? How does it progress? Because the staging, so I'm talking about staging. The stage of the colon cancer will determine which treatment would be appropriate. Okay? So for stage 1, colon cancer, this is when the tumor is not haven't this is the stage when the tumor haven't penetrated the colon lining, the colonic wall yet. Okay? So imagine your colon is a tube, right? So that tube is not that tube is similar to your piping, your the pipes, no? In your plumbing, household plumbing, okay? Similar to your pipes. So in that the pipes have its walls. Okay? So the tumor will grow inside the wall. Inside. Okay? So inside the colon. So when that at that stage, that's stage 1. So the definitive treatment for that is surgery because the tumor is still localized. So the surgery will now depend on the extent, no, of the tumor. How big is it? Say for example, at its earliest stage, it's still a polyp. Okay, so with a simple colonoscopy, okay, so a scope is inserted inside your butt, right? Then the one who's performing the procedure will immediately be able to identify the polyps. Some are cancer looking already, they can immediately remove that. And in that sense, okay, the colonoscopy is diagnostic and being done as a treatment already. It's curative, actually. And for all tumors, all solid tumors, surgery is the procedure that will most increase your survival or your overall survival. Okay, meaning the time that you have left here on earth, no, after getting the cancer diagnosis. Okay, so this is for very early stage, no, colon cancer that is still in polyp, that are still polyps. When the cancer increases in size, of course, you cannot remove it through colonoscopy already. Some sort of excision techniques, no, surgical techniques would have to be employed, no, more sophisticated. And sometimes the surgeon would have to open you up. So this is reserved for tumors that have grown significantly. Some probably are already obstructing the colon, the colonic space inside. And to some degree, this can also be done for stage 2 cancers already. So when we talk about colon cancer stage 2, this is when the tumor have penetrated the colonic wall already. Okay? So during this stage, surgery is still the mainstay. The tumor has to be removed completely. However, we have to consider the fact that it has already penetrated the wall. So there is some degree of invasion already. So some lymph nodes, by the way, colon cancer first invades the lymph nodes. So the lymph nodes would have to be harvested, dissected, and investigated under the microscope to investigate if there are any invasion. So if there are positive lymph nodes, no, that were detected, by positive meaning there are positive invasion of cancer cells in the lymph nodes, then you would have to undergo systemic treatment. Systemic treatment is when we are giving cancer treatment that will target the whole body, the whole system, the whole organism, or the whole body of the patient. So that is your chemotherapy. So why are we doing chemotherapy? Okay, it's because you cannot physically remove microscopic cancer cells. Why? It's because they are too small. They are microscopic. So you would have to kill them through medication. Okay? So another role of chemotherapy in this matter is it is used as recurrence prevention. Okay? So let's go back a little bit, no? What if the tumor is so big? Can we still do surgery? At this point, the surgeon will not, because the tumor is too huge, no? The tumor has to be removed in one excision only, no? It has to be removed in block. No, in other words, you cannot chop up the tumor inside and then remove them piece by piece, because that's gonna produce more spread, produce metastasis, no? And it will produce a lot of bleeding. Okay, so in this regard, you have to shrink the tumor first. Okay, so chemotherapy would have to be done first before the surgery. Okay, so in this sense, chemotherapy is also being used to shrink the tumor. So this is actually in medical term, no, neoadjuvant chemotherapy. So meaning chemotherapy is first given to the patient to shrink the tumor, then surgery will happen next. Okay. Now, this is for early stage 2. For stage 3 cancer, surgery can still be done, especially when the tumor is obstructing the bowel. So you have difficulty moving your bowels, you have vomiting, you have abdominal pain. So in this sense, surgery has to be done. Okay, especially when we need to put in or insert or install a colostomy bag. Okay, so a colostomy bag is when you have they will install a bag on your tummy to divert the flow of the stool. Okay, so in this regard, surgery is still very important to manage symptoms. However, the surgery performed in this case is not meant to cure the cancer already, or to treat the cancer already, to manage the cancer as a whole already. Okay, because the cancer has spread beyond its confinement. It has spread to the nearby organs. All the more with stage 4. Okay, for stage 4 cancer, the cancer has metastasized elsewhere, usually to the bones, to the liver, to the lungs, or to the brain. Okay, but for colon cancer, bones and liver. Okay, sometimes to the lungs. These 3. Okay, so when you are in this very advanced stage already, the surgery will be very, very minimal. The role of surgery will only be supportive to improve quality of life. The mainstay of treatment, no, would be systemic treatment already, like your chemotherapy, targeted therapy, immunotherapy, and other integrative medicine procedures. Okay, your supplements. So those are the things that you have to focus on when you are in this stage. Now, you mentioned radiation therapy. We don't do radiation therapy on colon cancers. Why? It's because the colon moves. You have peristalsis. The colon relaxes and contracts all the time. So the radiation therapy in this regard will not be effective because the target will be moving, keep on moving. So yeah, it's not gonna be effective. Radiation therapy is used for rectal cancer. So usually for radiation therapy, we only give it to tumors that are located in non-moving areas of the body. Okay? Fixed areas like your breast, rectal, your rectum, those parts don't move. Your limbs, no, the head and neck. We can also use radiation therapy for that. For the lungs, there are new techniques that wherein we can use radiation therapy for the lungs. Breath. That's it. But elsewhere, like your colon, we don't, because you cannot control or you cannot hold your colon movement. Okay, it's involuntary. Right? So I hope you understood my explanation. But these few treatment procedures, these are its role in every stage of treating colon cancer. Actually, cancer in general, for solid tumors in general, not just colon cancer.
Thank you, Dr. Jansen. That was very, very helpful and very clear.
Thank you, Dr. Jansen, for the very comprehensive sharing. Yeah.
It's true. I just realized the importance of really early detection for colon cancer.
So much. For not only for colon cancer, Sheila, for all cancers.
Yes.
You know, so that's why it's really important. And if anyone has caught their cancer, very oftentimes by serendipity or by, well, I should say as a blessing, you went in for another scan and you discovered the cancer early. Please start with treatment. Don't ignore, don't wait. All right, if you want totally natural, if you're in the early stages, this is an option. You can move to like late stage 2, with Dr. Jansen, and you will be able to choose the best strategy to make sure that you will be victorious. Yeah.
Excellent. Yes, and for those of you who wish to have a consult with Dr. Jansen, just simply type in how to consult. Miss Beth or Miss Irish will definitely get in touch with you, or just visit our description, and also in the comment section, there is a link for you to book a consult with Dr. Jansen. Okay, all right. Another question coming from Miss Helen Kamunayan. Can PPARS help with prostate cancer with bone metastasis?
Of course,
Yep.
of course, it can. Yeah, it definitely can help. Prostate cancer is one of the cancers that are slow growing, but of course, you are dealing with stage 4. Definitely, PPARS can help, but you cannot focus just on PPARS. There are other. We need to use other treatment modalities, supplements, to really put you into remission. Okay, but there is hope. There is hope. Right? So just to give you an idea what these treatments are, I'll be mentioning treatment modalities that you can find abroad and locally. First, those that you can find locally. Okay, if you are in the Philippines, so this is more important. High dose IV vitamin C can be used. Together with that, we can also use ozone therapy in conjunction with the high dose IV vitamin C. We can also utilize medications, medications that has anti-cancer properties. So this is using these medications for off-label use. Okay, so I'll give you an example. Mebendazole. Mebendazole is an anti-parasitic medication. Mebendazole has been shown to kill cancer stem cells. It has been also shown to induce apoptosis on cancer cells. So that's one of the medications that we can use. Another one is ivermectin. Ivermectin is the drug that became so famous 4 years ago, right? It is shown to have anti-cancer properties as well. So these are some medications that we can utilize. There are more like your metformin, your atorvastatin, your aspirin. We can also utilize that. For supplements, more natural products. You have curcumin is from turmeric. You have your garlic. You have your sulforaphane. Sulforaphane comes from broccoli. So PPARS is also one. PPARS came from a unique strain of chlorella. Yeah. Chlorella sorokiniana is the strain. Yeah, that's the strain that Simply Nature PPARS has, no? These are very powerful substances, no, that we can utilize. So there are actually a lot, no, that we can use. It's just that we have to find out which are effective. There are actually procedures that we can do to know which natural ingredients, natural molecules, and also the conventional ones, no? Your hormone therapy, your chemotherapy, which will be effective for the cancer. This procedure is known as your liquid biopsy. Yeah. They do genetic analysis on on the tumor, on your blood actually. Then they will find out which medications, which molecules, no drugs, which natural products are going to be effective against the cancer. Yeah.
So, I mean, what Dr. Jansen shared is one reason why at Simply Nature, we have actually tested our products for cancer. So things like curcumin, garlic, all that, these are things that you can eat naturally in your daily cooking, in your daily lifestyle. For Simply Nature, what we did for you is to actually highly concentrate the microalgae, the important PPAR agonists, and things that and the substances and the phytonutrients that will affect your fight against cancer, helping you fight against cancer more effectively. We've actually concentrated it into a form which you will not normally be able to eat. It's like asking you to eat a whole barrel of microalgae. You will never eat. It's like asking you to eat 3 kg of malunggay. It's not. It's just something not possible, right? So this is one of the benefits, and that's why PPARS is one of the first things that you can take straight away as you continue to explore. So it's very important, you know, we said to take treatment right away. When you know you have cancer, do something to fight cancer immediately. So you can safely take the Simply Nature PPAR protocols. You can start with the extracts, and then you can, and you must, and you should continue to explore what other protocols you can add so that you will have a complete strategy when it comes to fighting cancer.
Exactly. May I just say that for those of you who haven't been diagnosed with any illness yet, start tablets.
Yeah, that's really good for basic metabolic. You should ask Dr. Jansen. He's like champion in being able to help people wean them off maintenance many years ago. I think now it's like 5-6 years ago when I first met you. You know, Dr. Jansen really impressed me because he was, as a doctor, he was actually frustrated to see patients keep coming back and increasing their dosage for maintenance meds. And he wanted to look for a solution for that. And that's what started him on his journey. And now he is one of the top, well, in my opinion, one of the top 3. And he's so effective when it comes to cancer patients, right? Yeah. You know, Dr. Jansen, I just talked to Dr. Jason yesterday morning.
Oh.
Yeah.
You were in the conference, the Prima conference, Prima convention.
Yeah, and then one of like the top doctors at all the patients love you. So again, if you need a consult, if you're looking for a natural solution and yet want to understand what are your other options, especially if you need to explore surgery. Okay, so this is one thing. As a cancer patient, please seriously consider it. I understand when it comes to chemotherapy and natural therapy and more chemotherapy and radiation therapy, some of you might have concerns. But when it comes to surgery, it's really one of the very powerful options for treating cancer. And it's an option that's not going to be available throughout your cancer. Once it becomes stage 3, once it's spread, or if your cancer grows in a position where it's difficult to operate, then it's no longer is operable. So please do consider that. And Dr. Jansen works with one of the best too, Dr. Jimmy Katapia. So he's a surgeon that will also be okay with you, you know, going for your natural therapy together with your surgery and your chemotherapy, so you won't have any conflicts or confusion. So there's an excellent team of doctors to support you in your cancer care.
Exactly. Thank you, Dr. Jansen and Sir Shyan. Okay, for the next question coming from Miss Winnie Holman. Dr. Jansen, for this type of breast cancer, HER2 positive, ER/PR negative, and grade 3 or triple negative, does this kind of breast cancer spread fast? I am thinking not to complete my chemo, immunotherapy, and radiation. I will just keep my PPARS powder na lang, San.
Yeah, this type of breast cancer spreads quite aggressively. HER2 positive, if the breast cancer type is HER2 positive, that is very aggressive. But the good thing about being HER2 positive is that we have been able to develop molecules against that specific breast cancer type. So that is your Herceptin or your trastuzumab. Okay. So if you have a trastuzumab treatment, then the prognosis improves. It significantly improves. Okay. Now, for triple negative, this is a situation wherein you are estrogen receptor negative, progesterone receptor negative, and HER2 receptor negative. So there's no treatment actually that can, or at least no novel treatment modality that can be used for your case. You are left only with chemotherapy in this case, no. So if you are thinking of not completing your treatment, please don't. Yeah, make sure you complete. Anyway, you have PPARS, so
Yeah, right. I wanted to say that, Dr. Jansen. You know, if you are worried about the side effects of chemotherapy, you have PPARS. So this means that you have the best combination of strategy. You can have the effectiveness, the consistent effectiveness of these proven drugs for your cancer. And you don't have to worry about the long-term side effects, all right? Yeah.
Yes. Or else sayang if you don't if you don't finish your treatment. You've already invested a lot, you've already spent a lot on the procedures, no, the biopsies, the surgery. So I don't know if you underwent the surgery, but definitely the biopsy is there, right? Or surgery, or the hospital admission, the diagnostics, the went on to go see your doctors. Yeah, it's best to complete the treatment, or else the money and time and effort you've invested will be wasted. So you're already at this stage, so it's best really to continue the treatment and to complete, no, to finish the all sessions, no. So anyway, again, you have PPARS powder, but if you still need help, can go for a consult so I can look into your case, see what else we can do.
All right. Thank you, Dr. Johnson. Thank you, Sir Sean. Okay, another question coming from Mr. Kevin Alves. Is your PPAR safe to take during chemotherapy? Of course, the answer is yes.
Yes, not only is it safe, all right, it's proven, okay, to be able to protect your bone marrow and your spleen cells from chemotherapy damage, you know, especially cisplatin and oxaliplatin. We actually tested it with the chemotherapy drugs, and in actual use, right, what happens is that once you go on chemotherapy, one of the most common effects is that it will cause your red blood cell and white blood cell count to drop. And once that drops, you are not able to continue with your chemotherapy. So our oncologists and surgical oncologists that use PPARS use it to keep the RBC and WBC count high. So this is actually not only something that won't affect your chemotherapy, it's important for you to be taking while you're undergoing your chemotherapy regimens, all right? Yeah.
Thank you, Sir Fan. Okay, next question coming from Ms. Louis de la Cruz. Is cervical cancer also considered a genetic disease?
Very good question. For cervical cancer, the positive agent there is HPV. It's a virus. So in this sense, it's because of an infection. Okay. However, of course, not all patients will develop cervical cancer because of HPV infection, because you have your immune system. Okay. There are genetic susceptibilities though. So meaning there are genetic nuances that each individual has. I'll make it simpler. Genetic uniqueness, no, that each person has, that sometimes makes us more susceptible into developing cervical cancer when we get exposed to HPV. Okay? So, in this regard, is cervical cancer considered a genetic disease? The answer is no. Okay? HPV is caused cervical cancer is usually caused by HPV virus. It's just that um the question of whether we can fight off the infection and prevent cervical cancer, that is a question of genetics. Yeah. And of course, your lifestyle as well. If you keep exposing yourself to this virus, guess what? Chances are you can develop cervical cancer. This is when the saying of more chances of winning is is applicable. But of course, no, not winning in the sense of getting the cervical cancer. But anyway, joking aside, considered as a genetic disease, the answer is no. No, cervical cancer is caused by an infection of HPV virus. Okay. So since it's because of an infection, there are vaccines for that to prevent yourself from um, getting getting the being infected with the HPV virus.
Okay. There's a way to protect yourselves to prevent this one. Okay. Thank you, Dr. Jansen. Okay, another question coming from an anonymous sender. Should we do colonoscopy as random screening or only if there's already symptoms?
Huh. You have to do screening. Okay. This is especially important if you have a family history of colon cancer. So just ask your relatives or family member at what age was the person diagnosed with colon cancer. Subtract 10 years from his age. That is the age when when you have to start screening yourself through colonoscopy. Okay. Now for those of you who don't have any family history of colon cancer, you can start screening at age 50, 50. Then you can screen once every 10 years. Guidelines have changed actually. Some doctors recommend once every 10 years. Some doctors recommend once every 5 years. Yeah.
Okay. Dr. Johnson, this minus 10 years also applies to other types of cancers, right?
Guidelines, not all, but me, I follow that guideline. So say for example, for breast cancer, we start screening at age 40, 40. If you have a family history, in the guidelines, it says start screening at age 35. But for me, I may advise to start screening as early as age 30. This is all the more important if the patient has BRCA1 and 2 mutation or there is a strong family history of breast cancer. So say for example, the grandmother died of breast cancer, the mother has breast cancer, one of the sisters has breast cancer, one of the aunts has breast cancer, then I might start recommending to screen at age 25.
There's some considerations for this one.
Yes, yes.
All right. Thank you, Dr. Hudson. Proceed.
Yeah, let's continue.
Okay. All right. So for the next question, this is a follow-up question coming from Ms. Helen Kamunayan about the prostate cancer with bone metastasis. What's the best PPARS preparation or protocol for this one?
Liquid. Liquid.
Yeah, the liquid. So for all our viewers, right, they are asking about PPAR preparations right now. Are most effective for cancer and a whole host of other medical conditions is going to be the PPAR liquids. When it comes to maintaining the protocol, if you need to adjust the protocol so that because some medical conditions take a longer time to see the positive results, or rather you see positive results, but it takes a longer time for you to beat the disease, such as cancer. Cancer is not beaten in 2 weeks or 3 weeks, right? It's beaten over a longer period of time. I just want to let you know that our Dr. Jansen and also our customer services, service officers, our pharmacists like Ciela are there ready to help you adjust your protocol. I think one thing for all viewers to understand is this. I think in today's world, especially with the rising cost, managing your medical expenses is an important aspect. And here at Simply Nature, we are part of that process with you, all right? So, and Dr. Johnson is too, especially with his healthcare specialist. So just share with Dr. Jansen or any of our customer service officers who serve you about options where you can manage your medical cost, especially when it comes to using extracts and things like that. So again, you know, at Simply Nature, our motto is actually with you from start to healing. That also includes to make sure that you are on a financial plan or approach that will be sustainable and something that you don't have to be so stressed about, that you can manage. All right. So please don't be shy about this particular area, especially when it comes to cancer. I've talked to so many cancer patients. You know, Dr. Jansen, one of the most heartbreaking one is I talked to this mom who went through so many operations, a lot of operations, and of course chemotherapy. And then she was given the all clear sign. Then 3 months later, the cancer came back and more aggressive. So her friend referred her to me, and as I was talking over the phone call, she started to cry, and she said, "You know what? I want to give up," she said, because she said, "I've already spent my children's college fund. I don't want to spend any more of the money we've prepared for them." And that's just very heartbreaking, right? That means the mom feels so bad that the children's university college fund was spent on the medical bills, and she just want to make sure they have some, you know, so she didn't want to go for any more treatment. So I just want to let all our viewers know this is something, because we deal with cancer patients. We know this part of the journey is a very real part of your cancer journey. So please also allow us to help you and adjust protocols. At least, no matter whatever your budget, there will be something that we can do to improve your condition. All right. Okay. I just want to say that out there as an encouragement to everyone that's listening.
Yes, I just want to say very quickly, no, our team here with even the HCS with Ms. Beth, she's a trained healthcare specialist with certification. We also have for the CSO side, we have a pharmacist with Ms. Jhen and of course Ms. Daisy. Not only that are professionals, but have compassionate heart that takes into consideration your financial capacity also. So please share with us your thoughts and of course your experiences so that we can help you out further.
Oh, Sheila, I saw one question by Mr. Kevin Alvarez. He asked, why is PPARS not prominent for an option to those who are fighting cancer? So I think this is a very practical question and one that I would like to address. Number one, Mr. Alvarez, the reason is because actually PPARS is not prominent, right? If you just Google, if you go to PubMed.com, all right, that's actually the US Congress online medical library. You just type PPARS and cancer. So you see not tens, not hundreds, but thousands of medical journal and research on PPAR applications with regards to cancer. So PPARS PPAR agonist is actually a target by all the pharmaceutical companies when it comes to the treatment of metabolic syndromes and cancer. And if you look at treatment of metabolic syndromes, it's also looked into for immunodeficiencies as well. So basically, all these are root causes and related diseases to cancer. So from a medical research point of view, it is very prominent. It is very, very prominent. Okay, but it's just one class of molecules. Right, steroids application is almost across the board as well. Right, so it is prominent now. It's not very prominent in the market. All right, because PPARS first research is being applied onto metabolic syndromes, and it's next is research onto cancer. Now the challenge is that from the pharmaceutical point of view, they need to find a suitable synthetic ligand. All right, they need to find a synthetic drug that does not have interactions. So that's the main difference, is that you can't patent natural things. Like you cannot patent Gaiobano or, for example, Ampalaya for diabetes. All right, so drug companies will not create drugs that they cannot patent because they need to spend a lot of money to research it, right? And then, yeah, so that's one reason why it takes time. And of course, I mean, recently, a few years ago, the US tried to push a bill. I think they successfully pushed a bill to allow novel drugs or experimental drugs to be used on cancer patients who are terminal. So that's another reason why a lot of these drugs are still in the research phase, and it takes a long time for it to reach the market. I think it'll be at least 5 to 10 more years, right, before any of these can be widely used. Now, ours is actually a natural extract, so we target it for adjunct therapy. But those who want to use it for natural approach to manage cancer, then it can become primary, one of your primary protocols. Okay, so that's another reason. Now, we are actually getting a lot of prominence, right? In fact, I just spoke to one of the largest chemotherapy distribution networks in Philippines, and they distribute to all the doctors across the nation. So they were so excited, they were so interested because they were comparing our products with products like EMEN and other products that are similar in supporting cancer. So they're very excited. So we're in discussions with them. So you will see a wider distribution and very commonplace probably in the next 2 years. So these things in the medical industry takes a lot of time because there's a lot of protocols and safety things that documentations that they have to go through. So you're lucky, right? You're blessed that you managed to come to this program, and then there are doctors who are very well versed, who've been using it for many years, like Dr. Jansen, quite a few years with us already, 4 or 5 years with us, right, Dr. Jansen? So the records are there, the patients are there. So there you go, right? So and the best part is, I'm getting very technical here, but one of the reasons why the hospitals and the doctors are so enthusiastic when they hear us present is very simple. We've done things like LD50 tests. LD50 test is a lethal dosage 50 times test. So these are tests that normal supplements that you find on the market don't do, all right? We do that, and we actually test it out on cancer cells and things like that, and even chemotherapy drugs. So yeah, this is the best thing I think that answers. I just wanted to answer your question. I hope that gives you understanding and also confidence, all right? Also confidence.
Yes, this is a very valid question, because I think I'm also very pleased that our viewers, clients, and patients are very cautious before they try out the product, and they are researching so much about it. That's good. Okay. All right, another question thrown to us privately. The question is, does hyperacidity and GERD lead to colon cancer?
No. Hyperacidity and GERD can lead to esophageal cancer, but not colon cancer. Okay? Yeah. Too much acid that is produced by your stomach will be neutralized by the enzymes that is found inside your colon. Okay? So it won't the too much the high acidity level will not affect the colon at all. Okay? However, if you have acid reflux, the acid inside your stomach will injure your esophagus repeatedly. Okay? The warm feeling or the heartburn that you feel is inflammation because of the acid inside your stomach going up your esophagus. So if you have reflux, long-term reflux, you can develop esophageal cancer because of that. Okay? Yeah.
Okay. Thank you so much for that information, Dr. Jansen. Okay. All right. Another, Sir Shyan, have you made discussion with Makati Med Hospital management on your program and supplements?
Actually, this is actually I just talked to one of the head of our B2B because our distribution in medical hospital sites is actually called SMG. So I actually have talked to a few Makati Med Hospital oncologists, right? So, and then one thing is that our head of sales was actually at a new cancer center open in Alabang today. And the head of the cancer center was actually one of the doctors that we first approached 5 years ago. All right. So one thing great about the doctors when they talk to us, it's like, oh, wow, you're still here, So we are not, we were a serious company, and we took time to get ourselves, I guess, well positioned and also well accepted. It takes time because all these drug application, all these clearances with hospitals takes time. So it's not something that a fly-by-night company can do. So I remember the doctor at Makati Med Hospital actually said something very encouraging to me. He said, you know, trying to get a natural supplement into the pharmacy of a hospital is going to be an uphill battle all the way. He said that. He was very honest. But you know what he told me? It's very encouraging, very nice doctor. He said, but you know what? Try, right? Because what you want to do is a good thing and this helps patients, so try. And we've not been stopping. And guess what? I think it's a move in both trends that in the market. You know, Doc Jansen are very interesting. My cousin, who is a thoracic surgeon, right? He prescribed to my mom for her heart red rice extract. So it's not a drug. This is in Singapore, guys, right?
It's red rice.
Yeah, no. So number one, I was very shocked. You know, my cousins is and then this is why he told my mom, this is 100% natural. It's not a drug. It's gonna, so don't worry about it. So it's so shocking that that my cousin who's a top surgeon, right, heart surgeon, is recommending officially, you know, at his clinic and consultation, a natural red bran or red rice, you know, like extract. So I was like, wow, there is a trend, you know, that it's not only a trend, but there's a growing understanding in med school. They're also teaching the newer, younger generation of doctors that that natural supplements and extracts can be very useful in supporting the treatment. Of course, doctors, their number one tool is still drugs, but this is something that is growing. So with regards to the question about Makati Med Hospital, if you know someone that can help us further this conversation with the management, right, then please drop us a link. Our team will be so happy to pick up the conversation with them again. So we will actually be participating in the Philippines Oncology Society conference later this year. So in the next 2 years, you will see us approach and talk to more hospitals. But again, if any of our viewers, if your Ninong, Minang, or maybe your dad is on the board of one of these hospitals, yeah, please help us set an appointment. You know, we really have the data. We're very happy to talk to them. And I think in all our conversations I've talked to so many cancer center head of cancer centers. They are all very positive, right? They're all very positive. They just need a bit more documentation in the process as required by their hospital procedures, right? So we'll get there. We'll get there. Thank you for that question. And yeah, if anyone can have good referrals, please let us know, right? We will be happy to, and we're ready to talk.
Thank you, sir. Thank you for also mentioning that. This is something that I just want everybody to realize. We are not stopping on this position, and we are really looking for other venues and avenues to reach a lot of people that we can help also. Okay. All right. So I guess this will be our last question for tonight. Thrown to us privately by our viewer. The question is, I recently purchased AD Pro for eczema. Which step of skincare routine can I insert with it?
Oh, okay. Let me get this one because I actually talked to Professor here about this. Okay. Number one, right? First, clean your skin, right? Clean your skin. Okay. If you are using antibacterial or like steroid creams, right? So what will happen is that if you are using any of these medication, it will like kill every living thing on your skin, the good and bad bacteria, right? So you let it work first, okay? So after that you clean your skin again, then you apply the AD Pro, okay? Let the AD Pro dry. Then use a moisturizer to seal it, okay? The moisturizer is always advised to use a non-scented hypoallergenic moisturizer, okay? That's a very simple. Clean it, apply AD Pro. It's very thin, okay? AD Pro is very thin. You don't apply a thick layer. I know, because it's almost like water, right? It's not like thick glue or anything like that. So sometimes our patients and clients are surprised. Then they worry, they pump more. It's not thick enough a coat. You don't need want it to be very thick, all right? Just a thin coat, and it dries very quickly. The moment is dry to your touch, you can apply a moisturizer. So what the moisturizer does is that it covers the probiotic, and it sort of seals it in. Okay, there is a little bit of moisturizer in AD Pro, but not a lot. So a moisturizer on top of your dry AD Pro is a perfect combination. Okay, and then on top of that, if you want to put sunblock and all that, that's absolutely fine. Okay.
Thank you, Sir Fan. Okay, all right. Of course, just before we say goodbye to our viewers for tonight, which I know are combinations of those who just got diagnosed on the middle of their journey on remission, and of course our caregivers also of our patients. I'd like to ask for a very quick parting words from each one of you. Who would like to start?
I start, and Dr. Jansen goes today. Yay! Just a very big thank you to everyone. And today's questions are, a few of them are really new questions that I've not answered. And actually, some of these questions are really wonderful because it prompted something that just happened like 2-3 days ago, and like something that even happened today, the one about the McCarthy Med doctors, things like that. So everything is on a positive. I think many of our viewers are actually avid, I guess, advocates of trying to find that means you believe in not only like chemo or radiation, or some of you might actually prefer not to go down that route, and that you're actually propose approaches to managing cancer. So I just want to end on a positive note that this is also the direction which the medical community is. They're like making a U-turn already, all right? So they're no longer like, they're making a U-turn. They are also, I remember talking, right, Dr. Jansen, we were talking to one of the top oncologists in Philippines. He just came back from the US. We talked to him, I think, earlier this year. He actually said that the trend for all oncologists now is to use as little chemotherapy as possible. So that's a very positive turn, right, for anyone who wants to go natural. So it's great to know that many of your top oncologists in the Philippines are trying their best to not give you as little chemotherapy as possible, right? So that means they are also opening up to a more natural approach. So we really look forward to the next few years that there will be less confusion for yourself, for the patients, in terms of the messaging coming from your doctors, that they will be supportive of natural approaches in combination with their standard chemotherapy, radiation, and of course, surgery protocols. So we are all keeping our fingers crossed. We are moving in a very positive direction. And I look forward to that. Even TCM is also now starting to go into the mix, using things like acupuncture to relieve pain, help patients feel better when they go through their surgery, chemotherapy, and radiation therapy. So it's a good time. It's a good time to be a patient. There are more options now available, and the doctors are sort of supporting one another more than they ever have. Dr. Johnson.
Yeah. Actually, there's an ongoing convention right now in integrative medicine, and I can say that medicine in general is going in a very positive direction, because right now, as what Shyan said, there are a lot of mainstream doctors already who are incorporating complementary techniques, complementary supplements, products for their management of different diseases, not just cancer. Okay, this encompasses from degenerative diseases like stroke, Parkinson's disease, metabolic disease like diabetes, or your cardiac issues. So in general, it's going in a positive direction. However, this is also to answer one question, why is it not yet prominent as for being an option to those for cancer care? It's because it's not just PPARS who's feeling this resistance. It's also other products. It's because we still have to continue on educating the doctors, get the message out there that, hey, we can do more than just the conventional treatments that we have. Okay,
Yeah.
and these techniques really help the patients immensely. So, but of course, the concerns, the reservations of the mainstream doctors are very much valid. Actually, me,
Yeah, because
as
there
an
are a lot of
integrative, yeah,
there are a lot of
yeah,
I want to hesitate to use the word I won't say quacks, but there are a lot of there are a lot of medic there are a lot of so-called doctors who are not actual doctors, and they sometimes could be putting patients at risk. I think, sorry to interrupt you, Doc, but like Sheila is a great example. Sheila brought her son to see an integrative doctor looking for a natural solution for the son's third, fourth stage nose cancer, right? So Sheila, as a normal mom, didn't want chemotherapy, right? That makes sense to all our viewers tonight. So I really want to thank her doctor, Doc Maddie, who is an integrative doctor. So Doc Maddie doesn't use chemotherapy, right? She actually said, no, your son needs chemotherapy because the cancer is so aggressive. None of my natural approaches like vitamin C, ozone therapy, all this, it won't work fast enough for Dominic. So please send him for chemotherapy. But then again, if you send Dominic for chemotherapy alone, Dominic might not survive the chemotherapy because Dominic was very weak. So she sent the Dominic both back to the oncologist and also to us at Simply Nature. So the good news is, right, Dominic is very healthy and very smart, asking questions that Sheila cannot answer because he's doing very well in school. So, and he survived. He survived when half of his fellow cancer patients did not survive. That was the field that Don, your husband, told me, in terms of the patients that used to go for treatment with Dominique, right? So there again, that's a perfect example that, yeah, you want a very responsible doctor, even when you're looking for natural therapy, one that knows when the limits are when it comes to natural therapy. Because look, good news, the chemotherapy plus natural therapy, Dominic is healthy and in total remission past the 5-year mark, smart, doing well in school. What more can you ask for, right? Yeah, Doc, sorry.
yeah. It's okay, but it's true, no. But so thank you for that, Shan, because like what you shared with Sheila's experience, this is really something very important that doctors have to be open to other treatment methodologies, no, that can really help patients. And of course, patients, sometimes you are left with no other choice anymore. You are desperate, in a very desperate situation. So other treatment modalities have to be explored. No, so however, again, there are reservations. The reservations are valid. Even myself have reservations, no, because we do not want doctors in general are protective of their patients. It's just that if we encounter something that we don't understand, our initial reaction is to, hey, stay away from that. Okay. Okay, so however, patients, no, we hear you. We hear you. The medical community hears you. Okay, so we're doing this convention, and hopefully we put a very positive message out there for other doctors as well, no, and we move towards a positive future for medicine in general. Yeah.
Thank you. Sir Sean, Dr. Jansen, Mr. Kevin Alves, Dennis Morales, and Helen Kamulayan are saying thank you for the lecture tonight and for answering their questions with a positive note as well. And of course, also saying thank you for the additional knowledge that you have shared with us, all of us. So thank you as well for answering our questions and of course for your very encouraging parting words. I hope that what you've said tonight lessened the fear of our viewers in terms of whether they have to go for the conventional treatment or not. So thank you. And I hope to see you, of course, next week for another Q&A portion. Okay. All right. Right. Now, at this point, I'd like to invite everybody for another webinar here in Simply Nature that's happening on the 22nd of August, also at 7:30 in the evening. So it is about breast cancer. is the best time to try our PPARS because you have to make your salary work harder. Shop now and improve your health while saving your money because you can join our Simply Nature Sulit Sweldo sale for an unbeatable deal. So check out our participating items in our Lazada flagship store. Yes, we are very proud to say that we are not only on Lazada, but we are in Laz Mall. So you can be assured that what you are ordering or the orders that you are placing here with us are legit and authentic as well. We are also available via Shopee and via our website. You can also get our products here in our office at BGC, The Geek. All right. Your curiosity, your questions, and of course, most importantly, your victories over cancer is what keeps us going here in Simply Nature. Because here in Simply Nature, we're always with you from start to healing. Thank you, everybody. Good night, and God bless you all.
One reason why I recommended initially PPARS is because it can induce lung cancer cell death. The main reason why I tried PPARS liquid, and it did well for the patient. It helped with the tumors. The enlarged abdominopelvic lymph nodes were not detected. This was gone. So that was something that I was actually quite surprised. A 12-centimeter tumor disappearing.
Everybody turn to your neighbor and say, do more. Right? Don't just think there is no one product that will cure you of cancer. Okay, that is like it's like a scammer trying to sell you something. All right, it is a comprehensive approach. When you need surgery, do the surgery, but prepare for the surgery so that you recover well, right? And then if you need to do chemotherapy, radiation therapy, do it. So this is where PPARS really comes in. It's a gene activator, so it's a signaling pathway. It switches on your pathways, your systems. Then the other nourishment that you take will be properly used. Is it easy to understand now?
Now let's not keep you waiting. We are now officially opening the AMA or Ask Me Anything portion.
So she has to take maybe just the capsule or the powder just to regulate blood sugar. And then undergo the surgery. And after the surgery, to aid in wound healing also and for recovery, she can continue the capsule.
I can safely say this, all LJ products are great. But if you have acute illnesses like cancer, then we are a world of a difference. Because if you want chlorella, take chlorella. If you want spirulina, take spirulina. When you take Simply Nature PPARS, you're taking our microalgae for its PPAR agonist.
We are always with you from start to healing.